Bismillahirrahmanirrahim. Assalamu alaikum. Today we will discuss depression and diet. But before moving ahead, first we will discuss what is depression and how it comes. It is basically a persistent feeling of illness and sadness. It is a sense of helplessness. Any traumatic or any stressful life event such as death in the family, a divorce, a sickness, any career or any financial loss may be the culprit of depression. Now, some people overeat during depression. For them, eating is an easiest way to boost mood because comfort food activates the reward center of the brain, and many people want for the carbohydrates or soothing comfort food like ice creams and cakes. They eat to avoid any unpleasant emotions including despair, guilt and self-loathing. But some people cut back on their eating while depressed. Depression can make some people less hungry. In addition to depression disorders and anxiety, patients frequently experience nausea, diarrhea, or stomach discomfort, and which can reduce the appetite of a depressive patient, and due to the hopelessness and sadness, they can forget to eat. These are the mood elevators called dopamine, serotonin, oxytocin, and endorphins. In this video, we will discuss the dopamine and serotonin. We can naturally increase the production of dopamine and serotonin by working out, meditation, yoga, by improve the consumption of prebiotics, make short-term plans to achieve long-term ones, getting enough sleep, and spend some time in nature and getting enough sunlight. Basically, these types of activities leads to the production of some kind of proteins, some kind of amino acids called tryptophan and tyrosine. These amino acids further helps in the production of these two feel-good hormones called dopamine and serotonin and overcome the depression. Now, what kind of food helps to beat depression? The patient's family and the friends who are taking care of patient should add different fruits and vegetables of the patient's diet like apples, bananas, oranges, strawberries, watermelon, pineapple, guavas, avocados, and especially they add the dairy products like cheese, yogurt and milk. The high intake of proteins like chicken, egg and turkey helps to increase the production of tyrosine and tryptophan, which further stimulates the feel-good hormones. So a good amount of antioxidants, berries, walnuts, almonds, peanuts and a very little good amount of dark chocolates helps to cure the depression. So what kind of food should be avoided by the patient? Like junk foods, sugary foods, processed foods, saturated and fried foods, bakery items, refined foods, ice creams and donuts, all these things and alcohol should be avoided by the patient because these kind of foods leads to the excessive release of dopamine, and sometimes it gives you a euphoric feelings and makes you want to repeat the experience of eating more and more these foods. And these overeating of these foods leads to the obesity and some kind of severe health issues like cancer, diabetes, hypertension and heart problems, and leads to even worsen the depression.